Okay, well, as we used to say in the old e-dial days, the popcorn has subsided, so we'll get started. I'm Dean Woodbeck with Internet2 and InCommon, and welcome to the April IAM Online. IAM Online is brought to you by InCommon and Internet2 and the EDUCAUSE Higher Education Information Security Council. We will take questions today via the chat, so if you click on that chat button at the bottom of your screen, when you see the chat window, you'll notice the default is to send a message to panelists. If you could please remember to select panelists and attendees, that way everyone can see your question and everyone can also see the answer. Some of the questions will be answered during the webinar. Otherwise, we'll be watching the chat and then we'll pose questions at the end today because the topics build on one another. And yes, this session is being recorded. And actually the slides are now posted at incommon.org. I'll put the link in the chat here in a minute. And the link to the recording will also be at incommon.org/IAMonline after this, a little bit later this afternoon. So without further ado, we have three speakers today, and you can see their names on the title slide. And the first up is Ann West, who is the Associate VP for Trust and Identity at InCommon and Internet2. So take it away, Ann.
Thanks, Dean, and welcome everybody to this really awesome opportunity that we'll be hearing about from National Institutes of Health. As you all know, the research in the healthcare industry has gone a little bit over the top in the last year or so with the pandemic, and we've been working pretty closely with the National Institutes of Health over the last several years to engage infectious disease research and others. And we're just super excited that we're continuing down this partnership and able to provide you with additional value in this way. So today we're going to talk a little bit about the InCommon Federation context. Jeff Erickson from NIH will talk a bit about the why and what to do. Brett Bieber from University of Nebraska, as well as the chair of the InCommon Assured Access Working Group, will be talking about the impacts of the NIH requirements and what that could mean for you as an identity provider operator in InCommon. So as Dean said, we'll be taking questions at the end. There's quite a lot of material here, and this will not be the first time or only time we have discussions about this topic. This will be continued in the coming months. So no worries if you don't get your question answered today. We'll provide ways for you to get your questions answered in the future. So next slide, please, Dean. So the InCommon Federation was established to support a number of different use cases. But I think these three are really the top ones. One is, the first one was institutional access to library resources. So how do you enable an end user, authenticated end user, right, to anonymously access a service outside their organization? As a reminder, this is before Google, Facebook, and our kind of more social ID construct of federation. This was before then, so this was a little bit radical at the time. The second use case was institutional access to enterprise services. So things we know today like SaaS services, learning management systems, that kind of thing. Both of these require organizational contracts that govern them. And usually as part of those contracts, there's security requirements, information release about a particular individual or not in the case of the library and so forth, but those are primarily governed through contractual relationships. The last use case was access to collaborative resources. That's a very interesting use case because it doesn't require contract. It's usually an individual connecting with and working with individuals at other institutions around the world. And so many cases, IT, central IT, doesn't even know it's happening. How do we make that available? How do we make that work? So next slide, please. So the federation support is really designed around this particular use case. With any of those use cases, there's risk on both sides, both the identity provider and the service provider. However, in the collaboration use case, because there's no contract, most of the risk is actually at the service provider side. And so this is a way, the federation constructs is a way of both protecting the service provider and the end user. So you can see at the bottom, there's a basic collaboration that we enable, and that's the research and scholarship program, which is around releasing information about an individual to approved research and scholarship services. The federation operator approves all those services. And that's a very scoped information, email, name, and identifier. In the research and scholarship world, attribution is very important. So in this particular use case, this information is quite needed. Basic security, error handling also, so that if something goes wrong, the end user knows what to do. And then of course, accurate and complete metadata. So make sure that the two parties, the service and the identity provider, can connect if something goes wrong. So to support higher value services though, we as a community have developed two additional ways, and these are both international federation standards. There's one to signal multi-factor authentication to protect the service provider from essentially phished accounts. And then to be able to signal identity assurance information. How sure is the, and tightly mapped is the credential and the individual map to their attributes. So it's again, another security protection for service provider. So all of these taken together really address, or in part address, the risk that we normally in an enterprise service address with a contract. So next slide, please. So you probably have heard also, and this is my last slide, and we'll get on to Jeff, but you probably are aware of InCommon baseline expectations. So we're getting questions about the differences between what NIH is requesting and what InCommon is requiring, the InCommon community is requiring of all participants, if you've been tracking all of that. So in the first baseline expectations, we addressed essentially the basic information sharing and accuracy. You'll see that checkpoint next to accurate and complete metadata. And the next version of baseline, which is out there now, and we are working together with you all to ensure adherence on these two items. We're looking at some basic security and error handling. And again, those go towards helping address that risk that both identity providers and service providers have in the federated context. I think the thing that NIH is requesting, however, the research and scholarship program, so enabling that attribute release for just these approved research and scholarship services where that use case fits, is a next essentially seamless, makes it seamless for research and scholars to access these services. And then the signaling of multi-factor and the signaling of assurance needs and information are two additional things that, as you can see, address the security issues or some of the security requirements that service providers have. These three things are being considered for future baselines. So if you have thoughts about that, we'd love to hear that. Right now, they are out of scope. We're focused right now in baseline on the security and error handling, but these three additional requirements would go a long way, not only to protect research services and collaboration resources, but your own services hosted in the cloud, where you might say trigger multi-factor from a federated resource to your particular identity provider for a particular, to address a particular business risk. So with that, I'm going to turn it over to Jeff Erickson to tell us a little bit more about what IH is requesting and requesting from you and requiring for access to their services.
Thank you, Anne. My name is Jeff Erickson. Hello, everybody. Next team. So I'm here today to talk about why we're asking for partnership with you, and specifically what it is that we're asking. So for those of you who may not be familiar with NIH, the National Institutes of Health, we fund biomedical research, and to the order of, we're one of those unique federal agencies, I think, in which the vast majority of our budget, more than 80%, is spent on grants that go to principal investigators in institutions like many of yours, where you can see the quote there of what NIH's mission is: seeking fundamental knowledge about nature, etc. And that is on the order of $32 billion plus every year is given out in grants to research institutions like your own. So along the lines of what Anne was just outlining regarding the support for your researchers to get to NIH research enabling systems, what we're trying to do at the NIH is to leverage so much of the good work that you've already done, that InCommon has already done, that the federated institutions around the world have already done, and actually leverage those capabilities that you've already built in order to support secure access and minimize some of the risk for accessing NIH systems. So that includes three main things. One is that we're asking that you send us a basic set of information about people. This, yes, it is PII. It is not sensitive PII. So it is name, email address, some persistent identifier, and affiliation. That's number one. Number two, we're asking that you do multi-factor authentication for the individual. And number three, we'd like some assertion from you about how sure you are the person is who they say they are, right? So the why is supporting research and facilitating access by your researchers to NIH data. Next slide. So in terms of what it is that we're actually doing, or what's happening and when, we've broken this into really two phases. And some of this is a refinement of what you might have heard me say late last fall, that is a direct result of part of what we found in the partnership that we've had since January, really. But the main thing here in phase one is that I want to make sure that everyone is aware that in mid-September, one of our primary systems, the Electronic Research Administration System, is going to require multi-factor authentication. So the first thing that to support that system, that starting in mid-September, we are going to signal to you, our federated partners, that we need you to be able to interpret this signal that we're going to send. And I'll have more details about how this works in a minute. But the second part is that we're going to require that basic set of information that I mentioned, the unique identifier, name, email, affiliation. In other words, the ReFed's research and scholarship entity category information. We're going to require MFA in order to log in. So that is a new requirement from ERA. We also operate, I should say, it's kind of lost there in the middle of the screen, but there are other systems here at NIH that provide access to controlled access research data that many of your principal investigators have applied for and been granted authorization to access. So those, in addition to ERA, there are other systems at NIH that are going to be moving toward these same requirements. And in particular, with some of those controlled access research data sets, they are chomping at the bit for to leverage your capabilities to grant your PIs access to that data using your credentials, assuming you can meet these other requirements, sending this basic information into the MFA. And that last one, we are going to start accepting an assurance of the identity of the individual as outlined in the REFEDS Assurance Framework V1. So all of that is come mid-September is when that will go live. For ERA in particular, that's when the MFA requirement becomes ubiquitous. One note is that in the event that you are not able to meet these requirements by the middle of September, all is not lost. Your PIs can still access ERA, but they are going to have to go and get a credential from our colleagues down at the General Services and Administration login.gov community. The second phase that we've outlined actually relates mostly to that last piece that I just spoke about, the REFEDS Assurance Framework V1, which is the assurance of somebody's identity. Part of what we've realized in the last couple months is that that's easier said than done for a lot of organizations, and Brett is going to speak in more detail about this after me in just a couple minutes. But in order not to try and boil the ocean here, that's why we split up into a second phase where we put a stake in the ground for the end of next year, 2022, to really buy you all some time to figure out how you might be able to align policies and procedures that you've already got, along with guidelines that are actively being developed about how to advance the assurance framework related to some of these assurances these assertions about identity assurance. So Brett will say more about that in a second. So let me just dive in real quick with next, what it is in more detail, how the flow will work. So I'm gonna speak to this, and then we've got actually a little video that shows this in action. So the experience is one of your researchers comes to an NIH system. They select your research organization from the Where Are You From list that they'll be presented with. We then turn around and contact that identity provider, right? So we send something to you saying, hey, we need this thing back from you, which is the basic information that I mentioned and the multi-factor authentication. You then prompt that investigator for multi-factor authentication. After you've authenticated them, you turn around and send us that basic set of information, the REFEDS RNS information. You send us the assertion that you did multi-factor authentication of the person, and you send us the assurance of how sure you are of the person's identity. And assuming all goes well, the person then gets into the NIH system that they're trying to get to. So we've put, and I saw it go by in the chat. We put it here in the slides in case you don't have access to the chat later. Here's a link, and it's repeated elsewhere as well. But here's a link to a place that you, as the IDP admin, in order to check and see, am I ready? Can I do this now? Here's a tool we built that allows you to check and confirm your readiness for this. So next slide, and there's a video here, hopefully that will play in these slides, that I'll try and give the voice track. So this is the compliance checker. Go ahead and hit play. So this simulates somebody coming to this NIH site. So at the bottom there, you can see where are you coming from. So they'll select their institution from the drop-down list to say, I'm from this university. They select, hit continue. This is where we've redirected to in this case, the Wisconsin-Madison IDP. We've told that IDP, this is what we need from you, which includes MFA. They're now doing MFA on the Wisconsin user, and they sent back to us the claims that you see enumerated there, which include first name, last name, email address, and the persistent identifier, as well as the assertion that I know who this individual is at a level of moderate there, it says in the middle. That's it. So that simulates that researcher getting into an NIH system. You see the normal flow of they go, they select their name, their institution, we redirect, they log in this case with MFA, they come back, and assuming all the claims meet the requirements that we're setting up, rather than this compliance checker, they would now be in that system that they're trying to get to. So with this, I'm going to turn it over to Brett Bieber from Nebraska, University of Nebraska, who's going to talk through what some of this means to you, and then I'll come back and I can talk a little bit about some of the next steps that are in front of us.
Great, thanks, Jeff. Yeah, for everyone who I haven't met yet, my name is Brett Bieber, and I'm from the University of Nebraska. And I just realized, Jeff, I should have asked you to do a recording of someone from Nebraska instead of Wisconsin.
I know. Sorry about that.
All right. I love the folks from Wisconsin. Collaborate a lot with those folks. So it's great to have this. And thank you for showing the video demo of how a user, how a PI would actually interact with the system and get access to the services in a very high level. And also, thank you and Sumit for publishing a tool that allows us to actually try this out and see how it works and verify that things are working as they should be. Sometimes that's half the battle. So Dean, if you could go to the next slide. I want to kind of cover for the folks here that are an identity IAM practitioner, if you're an identity provider operator, what does this actually mean for you? And I want to talk a little bit about where you can get some additional information on some of the topics that Jeff and Ann mentioned. So the REFEDS assurance frameworks and the REFEDS multi-factor authentication. How can you get some additional guidance on how those work? And that we've been working within InCommon and within REFEDS to develop some guidance that will give you a little bit more concrete information, more details about how to kind of implement those. And I'm going to talk a little bit about the technical connections between each of the systems that are involved here that in the demo, you may not see everything that's going on behind the scenes. And I'll talk a little bit about that. And then get back to Jeff around what we recommend for next steps and what's the real ask here, and give you some guidance around how you can create your own implementation team on your campus to help make this happen. All right, so first off, let's talk about kind of a high-level overview of the technical connections here. And on this slide, I'm trying to highlight in the upper left, you've got a researcher in white up there, and they have a government-issued photo ID, and then they have their laptop that they're going to begin to access these services. And if you look starting from left to right, this researcher is coming to your institution, and they'll be interacting with you. We have our HR operations and processes there, perhaps potentially a card office that might issue them a campus ID card. Then you have your systems of record, identity and access management systems, single sign-on, and all the way ultimately ending up with this service provider, which Jeff's team is hosting there with the National Institutes of Health. So at a high level, these are the majority of the systems that are going to be in place or involved in making all of this happen. Some of these are technical, and some of these are not technical at all. These are business processes. So I'm going to try and walk through a little bit of each. First, let's focus on this one that's just on the left. And Dean, this piece of it here is primarily where you're having a physical interaction and you are actually examining the evidence that is provided by a researcher of who they are. As Jeff was saying before, how confident are we that the person is who they say they are? Well, that typically involves looking at evidence that they provide in the form of a government-issued ID. A lot of processes are already in place at many US institutions. All of us do the Form I-9, where you collect information from the employee, and you can optionally then use E-Verify to verify that information. But the user themselves would be providing evidence to you, and someone is typically taking a look at that, verifying to see that that person is who they say they are. They might look at the photo that's on that and verify that it's the same as the person who's standing in front of them, and the attributes, first name, last name, date of birth, etc., and verify those pieces of information. Another place where you might do this is within your card office. Card offices are also another place where you might do in-person proofing. Now, this doesn't mean to say that you have to do it in person. There are other options for remote proofing, and the Assured Access Working Group that I've been participating with a number of folks on for the last month or so, we're working on providing you some resources that will give you some guidance on how to handle these sort of processes that are probably already in place at your institution. You just may not be involved in them directly, but they're probably in place. And now we need to figure out how we can leverage that to bring it all the way through towards the service provider to assert how confident we are that the person is who they say they are. So on the next system of where this data might actually get entered in would be potentially within your human resources management system, or a card database for your card office. That might be another system of record that you might want to begin looking into. Where can you find information of that the evidence was verified and that that person is who they say they are? So here are a couple of suggestions around how to actually find that information. And at Nebraska, what I did is I started looking inside our HR system, and I was able to find information about the I-9, that the I-9 was performed for an employee and the date that that occurred, and also E-Verify optionally for more recent employees, where we've taken the information that was provided on the I-9 and we validated that against the federal government. So there may be evidence that those processes were performed on these individuals that you already have within your systems on your campus. You should start looking into where that information is stored and how detailed that information is. Does it store when that occurred? Does it store what forms of evidence were presented? Because I will say, Form I-9 does not require a government issued photo ID. There are a couple of exceptions to that can be valid for providing and completing the I-9 form. So while that evidence is helpful, I don't want to caution. I want to caution against people thinking that if you've done an I-9, that means that you meet a certain assurance level. You always need to take a look into that a little bit more, and that will be what some of the guidance is that we'll be providing. So anyways, your human resources management system may be a place where you could look for some of this information, as well as your card office. If your card office does in-person proofing, and then you store some information that a card was issued to this person because they came into the card office, presented a government issued ID, and you issued them a card, that may be another piece of information that you could leverage to tie back to map to an assurance claim. So that information would need to get to your identity and access management systems in the next slide here. So in our identity and access management systems, this is typically where you're going to take data from your HR systems, student information systems, card offices, and you may collect all of these attributes about a person. You're creating identifiers like a username that they're going to be logging in with, and you're probably also storing credentials for them, a password, your multi-factor, and then you may also start using a group management system such as Grouper, where you can compose an entitlement policy or a policy for assurance that might leverage some of those attributes that you have as evidence that assurance and identity proofing was performed. So you might compose that within a group to say, here's the group of individuals that we've verified their government issued IDs, and we know that they can meet the REFEDS assurance framework at the level of medium, for example. So this would be where that would be stored typically inside your Active Directory and LDAP, something like that, and potentially some other pieces of your identity infrastructure. That's typically stored and in a static place, and now we need to get that to your single sign-on environment. In the next system here, the data about that person, their identifiers, as we were talking about, all of those attributes and the attribute bundle that that pertain to the research and scholarship services out there, all of those attributes then need to be sent out through your single sign-on infrastructure, such as an identifier, who they are, and make sure that it's persistent so that when the researcher goes back to that service, you're sending the same identifier so that they can be consistently identified. The name of who they are, email address, all of those sort of research and scholarship attribute bundle attributes. And in addition to that, another attribute called eduperson assurance, which is where you would assert the ReFED's assurance framework. Also inside here, this is where your single sign-on environment is going to be able to interpret the request from that service that is asking for multi-factor authentication. You will perform the multi-factor authentication, and then you'll need to communicate back to the service that that was performed for that user or it was not performed. So one of the things that I think catches some people or confuses some people is that if we're saying that we're implementing this multi-factor authentication, that means that every user that logs in has to be protected by multi-factor. That's not necessarily the case. The folks that the folks that Jeff is interested in are your researchers that are going to be accessing these NIH services, which may not include everyone in your entire user population. So understanding that you've got that flexibility too. And if your single sign-on infrastructure, such as Shibboleth, can look at the user and potentially the user and the service in combination and know this service is asking for multi-factor, this user is required to use multi-factor, so I'm going to prompt for multi-factor authentication, and then have that all work and get asserted out through the single sign-on infrastructure. Those are a number of the pieces there that are going to be mapped within the single sign-on infrastructure so that the researcher can get access to the service. So on the next slide, the NIH has a service that is published within the Federation that is tagged with the research and scholarship entity category. And what that means is it distinguishes those services that have gone through a review to determine whether or not they are providing access to or support research and scholarly activity. And that is intended for you as an identity provider operator to have more confidence that the attributes that you're going to be sending to them will be treated appropriately and that they're necessary to support that activity. And in many cases, this is directory information, right? This is not very sensitive information. This is primarily directory information that if I went to your online directory for your institution, I would be able to see this sort of stuff without any difficulty. But this entity category helps you to understand within your single sign-on infrastructure, I should feel more confident releasing these attributes to this service because it supports research and scholarly activity. All right, so on the next slide, what I want to highlight here is that the researcher and where they actually interact with your institution is only, it doesn't have to be at all of these points. It can be at just a few of these, right? They're going to get hired. They may stop by the card office to get their campus ID card. They go about their university academic career, for example, and then they come to the point at which they need to log into a service. These are the very few points where they're interacting with your institution. And in between the left-hand side here, where they were hired, and the right-hand side, where they're going to be accessing a service, a number of years could potentially pass between this. So if you're like myself, I think I filled out my I-9 probably 20 years ago with the University of Nebraska. So it's been a while. So it's very important that when that proofing was performed, you have bound that credential to the individual. And for that entire duration of time, you know, and there hasn't been, you know, it's almost as if you've handcuffed something to their wrist, and that's maintained in contact. And I've had that identity under my control for that entire period of time. That would be termed a credential binding. We need to make sure that the user that you've proofed in person or with that government issued ID via remote proofing is the same person that you've issued that network credential to. and that when they go to log into that service, we can assert that claim all the way through all these systems down below. So keep that in mind, that you may have a long time frame in between when these events occur, and credential binding is an important part of that. Think about how you handle password resets. If someone's account is compromised, how could you reproof them to verify they are who they say they are and get them back up to that level that you want to assert within your single sign-on infrastructure? So thinking about those sorts of things, that'll be an additional piece of the guidance that we're providing within the Assured Access Working Group, and other guidance that other groups that are working on some of this will be sharing out within the next few months as we work through this together. So on the next slide, back to just the high level here, these are all of the systems that I wanted to kind of emphasize at a high level how this is kind of connected, and get you all to begin thinking about and understanding each of these pieces of this and how they all interact and what potential changes you may need to begin working on. It may be that you have business processes that are already working. We just need to figure out a way to expose it through all these systems so that you can assert those claims through the single sign-on infrastructure. It may be that you need to change some of your business practices or develop a policy that forbids the sharing of credentials to ensure that credential binding is going to happen, and you've got processes in place to make sure that is maintained. So there's a number of things that you may need to start thinking about, but this high-level diagram hopefully kind of explains where all these things potentially going to happen and which system owners or services may you need to start talking to make sure that you can support all of the things that the NIH is asking us to work on. The next slide, I want to talk a little bit and dive in about into the assured access, into the REFEDS assurance framework for the identity assurance profile levels, and just spend a little bit of time talking about this. As Jeff was saying before, we want to have some sort of confidence that the user is who they say they are, and these levels help us assert at what level of confidence we have in that person's identity. I want to focus a little bit first on local enterprise and then talk about the three different levels. Local enterprise is a unique claim level, and this can be thought of as you've done proofing and your business processes allow that individual to access some critical system within your own local enterprise. That is very useful. And if you're thinking that this might be like a reciprocity, I want to kind of change your mind about that, because as we've talked about within the Assured Access Working Group, the process that I go through on my campus may not be the same as your campus. And so those may not be equivalent, but I consider that all of the processes that we've gone through for this individual, they're trusted enough to access my own local enterprise systems. So the one example that we talked about within the Assured Access Working Group is the identity processes at the balloon factory. They may not be quite the same as the Pentagon, for example. So just saying local enterprise, that doesn't mean that they're exactly the same, but that means that they're trusted enough within your own university systems, for example. And if you think about this in the context of what we're trying to do here, there can be a lot of value in this, because if we're talking about the research and education sector or universities, that typically means that we're all doing very similar processes, and we trust these identities enough to access our own systems. So I think there's a lot of value to a service provider in understanding within the context of the research and education sector what a claim of local enterprise for assurance, there's a lot of value in that. Going beyond what is termed local enterprise, we have these three levels, and these can be thought of as more universal measuring sticks, because it doesn't have to be just what the research and education sector does, or the balloon factory versus the Pentagon. These standards, low, medium, and high, are an attempt to actually align a number of different assurance frameworks and explain them in a consistent manner so everyone is measuring themselves against a consistent measuring stick. On the next slide, This may be a little bit of an eye chart, but I'll walk through it with you all. This is an attempt to explain how the various assurance frameworks across all of the globe could be aligned with the REFED's assurance framework, okay? And the 3 levels that I mentioned, low, medium, and high. This slide is really targeted at service providers. A service provider that is being asked within their own industry, I have to follow NIST 863.3, for example, and I need to start asking my users for identity assurance level and authenticator assurance level 2. This slide helps explain if you are being asked to use the NIST 863.3 framework, how might the REFEDS, which is an international standard, how might that align with my local national standard that I have? So there's a number here. On the left-hand side is the REFEDS assurance framework, low, medium, and high. And then what the Assured Access Working Group has done is they tried to map the other various assurance frameworks on this to kind of explain, according to a spectrum of a universal measuring stick of how they are equivalent and how they are different and where they might meet up with one another, just for service providers who are trying to understand what this means, how you can connect the dots there. So NIST 863.3, we also have NIST 863.2, which some of you might recall. We had a lot of effort put into InCommon Bronze and Silver back in the day. These can be thought of as the Kantara Classic model and where those levels might align. And then there's EIDAS, which is a European identity assurance framework. So all of these here, this diagram is an attempt to kind of explain to a service provider how we might map those across the various assurance frameworks. And I'm very grateful that Jeff and Sumit and the rest of the team have decided to support an international standard for this versus a one country specific like NIST 863.3, which is just within the United States. Let's support an international standard so that we have an international measuring stick of how we can assert how confident we are that the person is who they say they are. And then within the guidance that we'll be sharing here soon, we'll be talking about those existing business processes. And on the right-hand side here, you might be able to see I-9 E-Verify, so Form I-9, which is that employment verification process that you go through within the United States, and E-Verify, where you might validate that information up against a federal source, how those might map in to low or potential or medium, depending on how that was handled and that you've bound the credential. So this is a little bit of a high level information here, and this will be included in the guidance that the Assured Access Working Group will be sharing. So one of the things that I'm reminded of, and I saw this just recently the other day from a colleague of ours, some of you might know Leif Johansson. He was responding to something on Twitter, and it was basically, how do you scare a developer in 5 words or less? And his response was, read this specification. So there's a number of specifications here, and I don't want to scare you all. I don't want to scare you all with what this all means. I want to give you confidence that your peers, we're working on providing some guidance to you all to help you implement this. And we've got a number of calls where we'll be focusing on this information, and we'll be publishing additional information on how to get everyone to what Jeff and the NIH is thankfully asking us all to do, because there's a lot of value in us doing this work, not only for accessing the NIH, but for our own internal services, other services coming down the road. There's a lot of value in going through this work. And I really appreciate Jeff and the rest of the team for making this happen. So Jeff, why don't I go back to you to talk about the ask and what you're really asking for here.
Sure, absolutely. Thank you, Brett. And thank you for all of that great explanation at the local level. So the next thing that I just wanted to summarize is to repeat, here is what we're asking for. By September 15th, if for federated access with your credentials to a system like ERA, that's when they're going to require MFA, as I've said. Please adopt the RNS entity category. We, the NIH, are a research entity, and thus we have no issues subscribing to that specification. Please do adopt the Refed's MFA profile as a way to signal that you've done multi-factor authentication. And please do adopt the Refed's assurance framework, at least V1. And Brett outlined some of that. I want to emphasize something here, that at a minimum, signaling local enterprise access, which means that, from my interpretation, that your organization has labeled that individual as being authorized for accessing systems that you could consider higher value within your organization. So it's not like just that they're accessing your email system, assuming that's not a high value asset, but that they're getting into your payroll system, or they're getting into your I don't know, the local system that your institution operates for managing research grants. So that at a minimum is in the phase 1 timeline, which is the September timeline. Next, and so in terms of next steps for you, and I'll take the first part of this, is just to reiterate, and I've seen just a whole bunch of chats about already testing with this compliance check tool, as well as a whole bunch of answers and follow-on questions about why you're getting 500 errors. Keep those cards and letters coming. I think that that sort of testing will help confirm, can you receive and process the signal that we're sending, that we want this Refed's MFA profile processed? Can you perform MFA, and then can you turn around and return to us the set of information that we're looking for? I want to throw in here a couple of target dates, and there's a new one embedded here of a June 2021, even before the September 2021. As I said a couple times, the September 2021 is when the ERA system will require MFA. The June 2021 is actually when we can start accepting your compliant assertions for access to ERA and other applications that we're running. So you don't have to wait until 2021 for your staff to start being able to leverage these capabilities. If you're able to process, you get a green check mark when you run this compliance checker. We still have some work to do on our side, but our target date for that release is June. We also need to go and work with the ERA team to make it the goal, though. What we're trying to get in place is well before their September 2021 deadline for MFA. We want to make it that your PIs can start accessing that system as early as June, along with some of these other systems that we are running. So that might be a carrot to put out there, that if you already support these things, you can already receive the signal, you can do the MFA, you can send these claims that we're expecting, then as early as June, your staff should be able to start leveraging your credentials for MFA access to some of our systems. And with that, I'll turn it over to Brett to tee up some of what is aligned with the phase 2 set of stuff that dovetails with what he was speaking about.
Yeah, the one thing that I hope is that everyone that is an identity provider operator can come away with is some thoughts about how they might start their own campus implementation plans for this. And I think the first thing to do is start trying to map out for yourself, how can you map out how to implement those assurance claims for the Refed's assurance framework? And to do that, in order to do that, you may need to actually talk to some other people outside of IT. So business operations staff, you may need to pull in some folks from research IT to make sure that they're familiar with what's going on. So you may actually want to create a task force that has representation from a number of the places that support these business processes, like the onboarding of new employees or your card offices, and develop a little plan to assess where does all of this actually occur, and can you identify the assurance requirements that you want for your NIH, principal investigators that need to access these services. And if you can't do it for everyone, just focus on just the people that need to get into this infrastructure, and then fill in the gaps, identify other gaps and how you might elevate someone that needs to get to that level. Let's say they were a student and then they want to be bumped up to that level. How could you accomplish that? And then go through and implement, if you have to make any changes to policies, start working on those so that you are in a position to build out and support these assurance claims going forward. So I think that's my hope, really, with what the timeline that Jeff has presented here, is how can we, on each campus across the United States, start implementing this and begin working our own campus implementation plans to support what the NIH is asking for, and what we, as in Ann's diagram was showing. These are all good security practices that help us advance the value of our own campus identity provider infrastructures and the security of our own institutional data, as well as the services that our researchers are asking. So it's all worthwhile work, and I'm glad that we're beginning to start to work on all these things together. Now, Ann, are you gonna help us kind of wrap up here?
Yeah, I'm just trying to figure out which questions to ask. And there's actually a question that we didn't touch on that I think might be helpful, Brett. And that is, how does local enterprise relate to baseline expectations? So we have all identity providers in InCommon are supporting baseline expectations V1. And in that is the second line is the IDP is trusted enough to be used to access the organization's own systems. So if an organization has an identity provider and they're in InCommon, they support baseline expectations 1, because it's a requirement, can they just assert a local enterprise as an assurance framework?
I would not do that. My recommendation would be to take a look at the local enterprise definition. And as Jeff was kind of alluding to, this isn't just that you manage a credential for somebody and you're taking ownership of their actions within every federated service out there. This is more about these individuals are trusted to access specific systems which might be in scope for what we're talking about here. And what we're talking about is, as Jeff was kind of alluding to, was people that have access to and can make financial decisions, make some sort of legal implications or legal decisions for the institution. There's a number of specific example systems that are provided in the ReFeds Assurance Framework talking about local enterprise. But I would caution against making a blanket assertion that everyone in your IDP is local enterprise. I think you should take a look at that a little bit more closely and really think about those individuals that might have access to sensitive systems, not just their own personal information, but they're managing the information of your institution. So hopefully that helps kind of clarify what I would recommend people do in terms of asserting local enterprise.
If I could piggyback on that, Brett, one thing, and this argues for the case that Brett was making and what lies ahead on into next year, is that we, as speaking as a federal system owner, we in the federal government have bars that are set by one of the things in the rainbow chart that Brett presented, the NIST framework, and they've got some very specific guidelines regarding the identity proofing and the credential binding that Brett was speaking to for the systems that we operate. And in fact, it's if you think from an auditor's perspective, if they look at us and say, how do you know that Brett Bieber is Brett Bieber. You're giving him access to this NIH system that says that you need to know that that's Brett, right? Well, I'm trusting University of Nebraska to know it's Brett. And so it's that shared trust that's really where local enterprise is the best we've got right now. But I think one of the reasons we all need to keep working on this is because the water level keeps rising with respect to the what represents the base minimum for identity assurance and, for that matter, authentication assurance that an institution might do. So even if local enterprise is quote unquote good enough for now, it won't always be. And that's part of where we're trying to say that we know that it just saying, well, if you're not doing identity proofing and can't tell us at the NIST 863-3 IAL2 level that you know it's Brett, then go away. We're trying to, we know that, as Brett outlined, that's going to take some changes at your institutions perhaps. And if that's the case, you need time to effect that change. So we're trying to have our cake and eat it too here and support the research that we fund, that your PIs do. And that's what we're trying to get to here. But know that the local enterprise won't always be the minimum that gets people into all NIH systems.
Yeah, right. I think it's signaling. We're trying to get signaling going with everyone right now, right? Signaling multi-factor, signaling assurance framework qualifiers, so local enterprise. That's phase one. Phase two is working with NIH to up the assurance framework levels to address their particular needs. So lots of questions here, and we can't get to all of them. There's one in particular, and maybe Jeff, you can throw an answer in there about InCommon versus a login.gov credentials. Can an individual have both? Do they need one? I think Sumit responded to, well, what if we use login.gov? Can we move to InCommon when we get that ready? So forth. So maybe post some things there.
Sure. I'll speak to the answer is you can have both. And I don't know if this was part of Sumit's answer. Hopefully we say the same thing, that one of the other things that we are working on is the ability for people to link different identities that they might come in with. So today they might come in with a login.gov credential because that's what they've been hearing from ERA, that they must use that. And then after June, we've all worked out, or maybe when your institution is able to support it, they come in with an institutional credential that we're able to link those, and that then no matter which one they come in with, assuming that they both have MFA and they both have the identity assurance, that then they can get to whatever NIH system they're trying to get to. So I think in the near term, the answer is yes, they can have both. And it's a bit of a pain because you have a driver's license and a passport, and you have to pick which one, depending on who you're standing in front of, which one do you want? But down the road, we'll be able to link those together. And, well, I should say, it'll be the user's choice if they want to link those together. We're not going to make them, but they'll be able to link those together and then use whichever one they want.
Great. Thanks, Jeff. And we're past time, but thanks, Dean, for forwarding the slides. Here's where to get more information. As he said, if you download the slides, you'll have all these links. So the next two slides, I believe, are just advertisements for, there's the IAM Online evaluation, very useful. Please fill that out and let us know if there are other topics you'd like us talking about. And then just upcoming, if you're new to identity and new to this whole community thing, come to Basecamp and provide an overview of of the InCommon Federation, identity and access management, this open source software that's available. And we're also offering virtual camp week again this year, October 4th through 8th. The first half is all case studies and you all sharing what you do. And then also have a unconference or advanced camp at the end of that week, which is always a fun time. So we will talk to you in May when Brett will be back again by popular request, talking about the Assured Access Working Group and their findings. So thanks everybody and have a great day.